Welcome to the Vets Talking Pets podcast. From scales to tails, real talk with real vets. No pet subject is off limits. With your hosts, Dr. Maggie Roberts and Dr. Vanessa Howie. Hello and welcome to this edition of Vets Talking Pets with Dr. Maggie Roberts and Dr. Vanessa Howie.
Hi Maggie.
Hello Vanessa.
So what are we going to be talking about today?
Well, we've got quite a controversial topic, but one I think that lots of people will want to hear about, and that is vets fees. Yeah,
It's certainly in the news at the moment, isn't it?
It is.
Very
It
topical.
It is, and we thought we'd explain some of the facts. We've both worked in private veterinary practice and the charity sector. We're not working really in either now, are we?
No.
We're just doing our own thing. So we hoped we could give some quite objective information. And yeah, people may have heard of the CMA, which we have to remember, it's the Competition and Markets Authority, have been looking into vets fees to see if there's not enough competition. So, but we'll talk a bit more about that in another episode, won't we?
Yeah, I think it would be good to understand what the CMA are looking at and actually what that means for the vet world and for you as pet owners. I suppose, should we start off by looking at why vet treatment is so expensive though? Because really there's a reason, isn't there, why things are the price they are. And I think it's useful just to try and explain that a little bit.
Yes, because I think we have to acknowledge that it is a big expense for pet owners. But the reality is that all medical treatment, whether it's for people or animals, is very, very costly. And I think often we don't understand the full cost as humans, do we? Because we're not paying up front. We obviously pay for the NHS through our taxes, but a lot of people don't really appreciate how expensive our own care is.
No, and I think if you're thinking as well about the dentists, actually, you know, some people are lucky enough still to have NHS care, so but obviously some people pay private, so that's a bit more of a similar comparison that we can use, I suppose, isn't
Absolutely.
it? Whereas we're so fortunate with the NHS for our human healthcare needs.
Yes, and when you think about it, a vet practice has to cover all those areas. You have to be a GP and a dentist, but also, be doing x-rays and the equivalent of a maternity ward and a laboratory and a physiotherapist.
Right.
And so you actually need loads of different equipment, don't you?
You do, yeah. I suppose the advantage for us vets that we can be GPs and do everything, so it stops the day-to-day being boring, but certainly means that you do need more equipment to be able to provide all that different care.
Yeah, and the patients being different species and different sizes. Even with dogs, we've dealt with everything from little chihuahuas to massive Great Danes. You need sometimes different equipment, don't you? Particularly when it comes to things like anaesthesia and whatever. So, yeah, there's an awful lot that has to be bought. Just a surgical kit is very expensive. Each individual, pair of scissors or whatever is, I don't know how much they are now, £20 or something for each bit.
Me how expensive they are.
So if you have a kit that's got 20 or 30 bits of equipment and you need several different surgical kits, if you're doing lots of operations, then it all really adds up. But obviously, specialised buildings, surgical suites, consulting rooms, wards.
And the turnover to everything being digital as well, that's also bumped up costs, isn't it? So we've got digital x-rays and other things like that these days. So ultrasound machines have certainly advanced from when we both started out. Did ultrasound exist when you graduated, Maggie?
To be honest, we weren't taught very much about it. The only ultrasounding we did when I was at college was with sheep to see whether they had singles or twins. And we didn't really do any diagnostics, particularly companion animals. Yeah, x-rays, and there was some fluoroscopy, which is like a moving x-ray. We did a little bit of that, but No. So, yes, I still would say I see them as snow in a snowstorm. But yeah, but they're expensive machines.
Yeah, and I think that's something we also need to remember, isn't it? That the 40 years that you've been qualified, actually, we didn't have a lot of this diagnostic equipment that we now use. So things will have gone up because the costs of running those machines, buying them, maintaining them, etc. So there are those added costs.
It is, and so much has changed over the time that I've been a vet. And, it's good that things progress and we get new technology, but it does come at a price. And there's more specialism as well within veterinary practice now. So again, that just means more expense. And obviously there's all the ordinary things that any business has to cover the cost of, things like gas and electricity and just paying the council tax or whatever. It all adds up. And you have to pay for your staff.
And you do, and I think there's, we've got highly skilled staff, haven't we? So we've got nurses, just even with their normal nursing qualification, but some may have further qualifications as well. We've got vets that may have studies as well for certificates and further qualifications, so they have a specialism even within your general practice, not thinking even about specialist referral practices, but just as your GP surgeries. So along with that, those staff also need to keep up to date, don't they? So they're having to do continued professional development. So that certainly costs, and the courses these days are not cheap, I would say, to go on.
They're not. And we have to do 35 hours every year. So that's a working week that we have to do what's basically continual study to keep up to date. And obviously that's really, really important. But a lot of the conferences are £500 to £1,000 just for a sort of weekend course, and then hotels and everything, so it does add up.
And just to say, it's really important that as vets and nurses that we are doing this as well, isn't it? This is the thing. So you would much rather take your pet to see somebody that is actually up to date with how to do things and keeping on top of that learning, rather than somebody that's still 20, 30 years out and is actually using things they learnt 20 or 30 years ago, because we have seen lots of changes in those times.
Absolutely, and lots of changes for the better. So it is really important. Now we come to again, controversial question: are vets paid a lot?
Well, I suppose it depends what you mean by a lot. I think that's the important word here.
Yes, and how do you value those people and what training has gone on? And I think, to be fair, vets' salaries are relatively modest compared to some other professionals who perhaps have done a similar length of training, something like a doctor or a dentist or a lawyer or something like that. And the national average full-time wage in the UK before deductions is 39,000, which actually was higher than I thought it was going to be, but I suppose there's been a lot of inflation in all sorts of different ways. And obviously it depends on lots of different things within any job, your experience, your age, sometimes your sex. I know it's not legally meant to be, but it still happens. So we thought we'd tell you a few average salaries of vets, and this obviously is per year. When they're newly qualified, it's usually between about 34 and 37,000.
Do you know, when I qualified, I was on 17,500. I remember that, but I did have a flat and a car to add on to that. So
but when I had my first full-time job, which I started in 1987, I was paid 10,000 a year, which at the time was actually pretty good for a new graduate, and I also had a flat and a car. So I felt pretty well off at that time, because we'd spent so long being a student, and obviously vets do spend 5 or 6 years being students, that you felt quite wealthy. I was lucky enough I didn't pay university fees. My county council paid them. Now vets do tend to come out of university with fairly heavy levels of debt. If you're a bit more of an experienced vet, you're looking more at sort of 40 to 70,000, aren't you?
Yeah.
not a specialist, but someone who's perhaps been out for a few years. Um, Obviously, there's not quite so many of the traditional practice partners, like the sort of James Herriot types, but obviously with the practice, you're getting a bit more money, but still on average we're talking 70 to 100,000, which obviously it's not a small amount of money, but considering, I suppose, the sort of investment with education and everything, it's not.
And the hours worked as well, I think, as
Yeah,
well.
absolutely.
I think if we compare that maybe to just salaries of doctors, I think we're looking at the kind of the F1 newly qualified doctors around about 39,000. We found that's what on average they're earning, isn't it?
Yes.
So
Yeah.
and your GP
Yeah,
around
about
82,000, was it?
82, yes, and experienced consultants, 140,000 plus. And, to be honest, I don't think that's a lot for doctors. They've
No.
got huge responsibilities, and they usually work pretty hard, and
Yeah,
particularly
very
those
hard.
poor F1s, what used to be the sort of housemans or whatever the terms were, that they work really long hours. But one thing we were going to add in is NHS workers do actually get quite good pensions, which is something that vets don't have the same system all the time. When I started, there were no company pensions. Obviously, there's a little bit more now, and probably a little bit more with the more corporate practices, but it's certainly not as good as NHS ones. And if you look at lawyers, they tend to earn more money, don't they?
Yeah, they do. And I looked at the other industry I looked at was the train drivers, because obviously
Oh
they've been
yes,
striking a
yeah,
lot recently.
yeah,
So I was
yeah.
just curious to look and see. And I know I've used a little bit of a AI search engine, but actually they were saying some of the train drivers can earn up to 70 to eighty
Oh
thousand.
yeah,
So I think, yeah, I
yeah,
was quite blown away by that. But just in comparison to what we're earning. But yeah, in terms of lawyers' salaries, I think if you're these are just kind of your town solicitors,
yeah,
maybe, rather than the big city
yeah,
firms.
yeah,
Trainees might earn up 25 to
yeah,
40,000 as their kind of entry level,
yeah.
and then you've got the more experienced solicitors earning between 60 to 100,000, and partners will be earning a little bit more, sometimes up to 140,000. But if you're thinking about the top
Yeah,
firms,
the
then
top city firms, we're talking millions, and they don't really do weekends or out of hours cover or anything
no,
like
that's
that.
right.
But yes, they do a lot of training and often have a lot of responsibility. But yeah, I think that just gives you a little bit of an idea that certainly being a vet is not the way to make masses and masses of money. And most
No.
people don't go into it for that.
I know, and
But
that's true. If we
yeah,
wanted to earn lots of money, we'd certainly choose a different
yeah,
career, I think, wouldn't
yeah.
we, rather
I
than
think I think I
going
think
into the
we
vet
would,
world.
and that the money you pay when you go to the vets, a lot of it is covering all those overheads. Um, Another thing that actually does mean that the veterinary medicines are very expensive is there's a lot of legislation and regulation around them, and vets must prescribe the veterinary versions of drugs. Often there is a human equivalent that is pretty much the same drug and is much, much cheaper, but we're not legally allowed to prescribe those drugs.
And I suppose a comparison on the human field will be, for example, a paracetamol. You know, if you go into your
Yeah,
local pharmacy, there might be a
yeah,
paracetamol that's just called
yeah,
paracetamol, but then
yeah,
you'll also get a trade name
yeah,
branded type of paracetamol, which will
yes.
be a lot more expensive. So,
Yes,
um,
and the reason for it really is because there's sort of extra testing that goes on in veterinary medicine. Firstly, we're dealing with lots of different species, so they have to be tested on each different species they're licensed for, because they don't all react the same. Like aspirin is quite toxic to cats, but actually dogs can tolerate it quite well.
and it may be that it's only ends up being licensed, isn't it, for one species,
Yes,
because actually the cost
yes,
to test on all
yeah,
species or another
yeah,
species is more expensive. So
yeah,
actually that would really knock up the cost even
yes,
more. So the
it
companies
would.
choose not to, and then later on down the line they may then do the tests needed if
they want to get it licensed for another species. And in food animals, then they have to actually cover what we call the residues, that if you give something like a course of antibiotics to a cow or something like that, it will stay in the system for a while, and obviously it can only go into the human food chain once that's out of the system, because it could be an antibiotic that someone's allergic to, and it that affects the milk and everything, doesn't it, as well?
Yeah,
so
I was going to say actually, which I think we should have touched on at the beginning, but we're talking very much about the UK
yes,
here, aren't we?
Yes,
so actually,
we are.
Laws as well around residues and medicines are a little bit different to some other countries in the world. So we're much tighter in the UK, like a lot of the European countries, other European countries.
But in other parts of the world, you can sometimes get what we would consider to be prescription only medicines, but you can buy them just over the counter. But there's lots of issues with that, which again is a whole other podcast about resistance to antibiotics and all that sort of thing. And also, talking about the drugs, vets have to buy their drugs from licensed wholesalers, which is sort of quite limited actually in the UK, isn't it? You don't have a lot of choice, and they are more expensive than some of the prices on online pharmacies, but vets can't get their drugs like that. It has led to some of the corporates actually setting up their own online pharmacies. But it's another factor as to why the drug prices may seem quite high.
Yeah, and the difference between those online pharmacies is they're buying the drugs large quantities, aren't they? So actually by buying them, they can get them at quite a reduced cost. So when you're seeing those prices online versus what you're seeing in your vet practice, actually that's because the pharmacist is benefiting from cheaper purchase prices. So it's not necessarily that your vets have put on even bigger markups. It's actually what they bought the products for will be more expensive to start with.
And it was interesting when we worked in a big charity. Actually, they weren't meant to give charity discount. They were only meant to give discount because of the volume of drugs that we were buying. And obviously we were buying lots of vaccines and things like that because there were lots of cats that were going through our care. So there's all sorts of restrictions and things that perhaps people are not really aware about. But obviously you can ask your vet to write your prescription.
You can.
And then that means you can then use that at either I was going to say real pharmacy. That isn't what I mean. I mean an actual in-person pharmacy or an online one. And obviously it's better to go to an online veterinary UK-based wholesaler. Obviously with the internet you can buy things that actually are from pharmacies abroad, but then you're not always sure what you're getting.
I'd always be very, very cautious with that. And certainly buying from UK online pharmacies.
And most ordinary, high street pharmacies don't have much in the way of veterinary medicines normally.
Just a note, I suppose, that your vets will usually charge you a fee as well for writing that prescription. But you'll often find that the fee plus the cost of the medicines bought through a pharmacy might be cheaper. And even if that's an in-person pharmacy, sometimes the drugs can be cheaper.
And I think particularly where perhaps a pet is on long-term medication, that can be a really good thing to think about. Obviously, if you've got something like quite an urgent case, you might just want to get the drugs there and then from your vet. But obviously you do have that sort of choice. But if there's an emergency situation or drugs that perhaps have to be given, not in a tablet form, but perhaps by an injection or something, then it's much better just to get it sorted there and then. And as we've mentioned before, obviously there's no NHS for pets, and vet practices have to make a profit or else they wouldn't continue to exist. And your average veterinary practice has a profit margin of about 12 to 18%. Certainly when I was running a practice, ours was about 14%, which obviously fits in with that average. And when you look at the average profit margin for UK businesses that are in a service industry, it's around 15%. So it's the same really, it's within the bracket.
Within it.
So the actual profit is not massive compared to other businesses. And as we mentioned before about, obviously, we don't have an NHS for animals, we thought it'd be interesting just to share some of the prices of veterinary costs compared to equivalent either surgery or procedures with the human cost if you were going to go to a private hospital. So, for example, if you're going to have a total hip replacement, which obviously is quite a common procedure in humans, it's going to cost you round about £14,500. We don't do quite so many in human medicine, do we? But we do a few
Veterinary
on dogs.
medicine, do you mean?
Veterinary medicine, sorry. Yes, vets. Some dogs.
Yeah.
That's about all. I don't think people do them on cats or anything.
No, I don't think so. I think it's generally just dogs, bigger dogs.
It's usually bigger dogs, isn't it? And that's from about 7,800. So it's about half the cost. So that's quite interesting, particularly as actually it's done much more commonly in people.
Yeah.
I think that might lower the cost.
You would, wouldn't you?
Yeah.
The general, I think the next one's going to be quite interesting for people, isn't it? So
yes, it is.
That good old basic spay that we carry out as a routine procedure on our female dogs and cats. Actually, it's complicated surgery, and if we look, the fancy name for it is an ovariohysterectomy.
Yeah.
And in people, we're looking at around between 6,000 to 11,000 for that surgery. It depends on which technique they use, because there are a couple of different ones. But if we look at that, particularly for the equivalent laparoscopic one in pets, it's up to £600 to £850. But if we look at just surgery, £300 to £400. So it's a massive difference.
It's a massive difference, and I think the length of time it takes for a human is roughly the same it would take for a sort of biggish dog.
Okay.
A cat spay's quicker, and cat spays obviously can be a lot less than that. So, I mean, neutering is such an important bit of surgery from the point of view of animal welfare and controlling animal population that actually it's a bit of a sort of either loss leader or subsidised really by the practice for welfare reasons and to get clients in through the door. I think we have to be honest about that. But they're not charged at the normal surgical rate. But, you know, there's not that much difference other than you probably get a slightly better bed and better food if you're a human in a private hospital. But actually you get a lot of tender care, don't you, with a vet. So there's a huge difference in that. And what about dental treatment?
Dentistry. So I think looking at the cost, actually, there's not a huge amount of difference, is there? I think we've got both comparisons here, but the extraction of one tooth for people, it does depend on which tooth, because obviously some are easier to remove than others. But we're looking at a range of around £95 to £600. Compare that to a medium dog. We're thinking about just a basic descale and polish of those teeth without extractions. Might be £150 to £500, but we have got a general anaesthetic as well, haven't we, to think about that's included in those costs.
Yes, and I had my teeth descaled recently, and they managed to do it without sedating me, and this is with an NHS dentist, and it was about £70. So you know, and obviously if you've got a dog or a cat, there is no way that you can do a proper job or actually keep your fingers if you didn't give them a general anaesthetic.
So you didn't bite the dental hygienist?
No, I didn't.
You're very good.
I didn't.
Well
I was
done.
very good. And extractions are not that different really, are they? But again, it includes general anaesthetic. But you're talking nowadays probably 500 to, well, over 1,000, 1,200.
Yeah.
Taking teeth out is actually quite hard.
It's very hard work, and it does require some expertise as well to be doing it properly, particularly those big back carnassial teeth that we see in kind of bigger dogs. So.
And that's it. And even with cats, you know, those teeth are not designed to fall out, because
really
obviously
not.
in the wild they wouldn't survive, and so they're actually quite difficult to take out. And what if we talk about a CT scan, something we definitely didn't have when I was a student?
So yeah, for people we're probably looking under sedation or a general anaesthetic between £1,000 to £2,000 for that. And actually this is a really similar for our kind of medium dogs as well, isn't it? So under sedation or general anaesthetic, about again 1,200 to 2,000. And I think we're seeing more CT scans, aren't we, now in practices?
Yes.
So actually the costs are probably coming down a little bit more now. It's more accessible.
Yeah.
You know, certainly when I was at university we used to have a visiting MRI scanner that used to come, and actually that was really expensive, just to scan one small portion of the animal that we were looking at. And I think even those costs probably have come down, but there's a lot of running costs involved, aren't there? And
there are
property building requirements that you need around scanners, so these big CT and MRI scanners, so actually that will bump the costs up a little bit.
Yeah, and some of the universities have ones that you can even do some on horses. A bit of a horse usually. I don't think you can do the whole horse, but you can put the head in, because I visited Edinburgh University, which is my old vet school, and looked at their latest cat scanner, which has got a sort of separate door they can lead a horse through. But a CT scanner costs between about $250,000 to $500,000. So if a practice invests in that, they've obviously got to be charging for it. And it's interesting, actually, the cost for a human it's very similar, because actually it's similar time and the machine is similar, that sort of thing. And obviously there's a lot of TV programmes on now on television showing veterinary medicine, and particularly specialists, and there's all sorts of complex things that are shown, but they don't actually talk about the price very much, do they?
No, they don't.
So sometimes people will see things and think, oh, that sounds great, you know, we can have all these things done now for our pets because technology and skills are advancing. But I think often pet owners don't appreciate the costs of some of those really expensive, sort of particularly orthopaedics and things like that.
Yeah, and I think one of the problems is that the costs start to add up as well, isn't it? So various different things, like a procedure might cost X amount of money, like we've just given the examples of, but then if you're having your examinations, repeat examinations, antibiotics, anti-inflammatories, all these extra things, an X-ray here, an X-ray there, it all starts to add up. So the total cost can actually become very, very expensive when you might not be expecting it. So certainly always recommend that you get estimates beforehand from your practices before you go ahead with anything. So.
And I think it's important to say it is an estimate. It's not a quote. Because there's all sorts of things that can vary between animals, and it might be that if you've perhaps got an older animal and they're having an anaesthetic, that you might want to put them on a drip, an intravenous drip, to help support their circulation, and then that obviously has to be charged for. So it's quite difficult to give an absolute quote before something that perhaps is complicated. And actually, how many days are they going to have to stay in the vet hospital? Because obviously that has to be a charge as well, because they'll have staff there 24 hours. So unfortunately, it can really, really add up. But I suppose there are some other factors about cost, aren't there?
Yeah, and I think we've got to talk about the gold standard treatment, haven't we? Because it's really topical in the vet world at the moment. So I think we all at vet school tend to learn how to do things. It's not even the best of the best, is it? It's to a high level in terms of the most advanced treatments, I think is what I would say. We have all of the universities have referral practices attached or associated with them, so specialists, and that's kind of what we learn as a student. We're not learning necessarily everyday GP treatments, so everyone comes out of university thinking that maybe those should be the things, the treatments that you should be giving and how you should be working to, but the reality of it isn't that's not the best. It's not the best for welfare in every animal in every case, depending on that individual animal and their owner. So that can seemingly therefore also bump up prices, or actually bump up estimates and ideas of treatments, isn't it? I think.
Yes, because for many, many situations, there are different options for treatment, and some may have a better outcome, or would you predict a better outcome, but it might be they're more expensive, or there might be things where there's an awful lot of intervention, a lot of handling, a lot of things that the animal might actually find really stressful and difficult. So it might depend on the animal as to whether it's suited to that or what the outcome is. So I suppose when we get to talk a little bit later on about how we would advise you to try and get the best value from your vet, that sometimes talking about the different options is really, really important. But I do think it means that a lot of people come out of vet school thinking if they don't do absolutely everything that could be done, that they're a failure almost, or also they're worried that they'll get into trouble or they'll get sued.
Yeah, so I think we're seeing a little bit more in certainly the newer graduates, aren't we? Seeing more defensive medicine that's happening. So that whole thing, that fear factor, that worry of litigation, the worry that they're not doing everything they can, what will their peers and colleagues think of the treatment options that they've given. So there certainly is this defensive medicine fear going on at the moment.
Yeah, and I do think vets tend by nature to be perfectionists.
Definitely, it's the stereotypical type of vet.
Yeah, it is, and that if things don't go 100% to plan, it causes a great deal of anxiety. And with medicine, be it people or animals, they're living things, and that means that things, despite everyone's best efforts, may still not always go to plan. So it can be emotionally quite tough, really.
And I think we probably should just wrap up by talking about euthanasia as well again, just to say that actually euthanasia can be a really useful welfare tool. And so actually it might be the most realistic option. And vets also might suggest it, okay? So some owners may find...
they might be surprised,
yes.
And it's not ever like the easy option, either for vet or owner. But it is something that sometimes is the best option rather than putting an animal through a lot when the outlook is poor.
Indeed.
But even for vets, they sometimes, particularly I think younger vets, see it almost as failure. Yeah. They don't want to be seen to be giving up on the animal. But I think you've really got to think about what's in the animal's best interest. I mean, one of my cats had a lot of problems with getting a blocked bladder, and in the end I did have him put to sleep because he was just so distressed by going through it repeatedly. And yes, he could have been referred and all sorts of things, but he just knew that it was going to keep being a problem, and it was a really hard decision. But although it was hard, I'm glad that's what I actually did, give him the really difficult circumstances. So it's really hard.
Yeah. But I think we'll come on to talk about euthanasia a little bit more, won't we, in another podcast. I think it's worthy of a whole episode. But just kind of a final thing to say is that even where there's euthanasia might be a treatment option, if vets do carry on and offer other options, the other options will not generally be money based. It's not because they're trying to do treatments unnecessarily to get more money in. It will be that actually they, as you said, that fear of failure and that fear of not doing or giving everything they can to try and help that animal. So
and not giving an absolute diagnosis, because there are some things where, particularly with old animals, where particularly with experience, you just know they're not going to do very well, and there are different possibilities to the diagnosis, but they're all bad. So actually putting the animal through lots of testing is sort of academic. But sometimes it's that feeling of we must get a diagnosis. So that all sounds like we've ended on a slightly down note.
It does, doesn't it?
But I hope that's sort of given you a bit more insight into what goes on in veterinary practice. I'm sure some of you may have questions, which you're very welcome to send in to us.
Yeah, but that's all for today, isn't it? We'll hopefully in the next episode cover a bit more on the CMA and what's currently going on in terms of investigating the fees in vet practices. So until next time.
Until next time, goodbye.
Bye-bye.
Thank you so much for listening to this episode of Vet Stalking Pets with Dr. Maggie Roberts and Dr. Vanessa Howie. If you have any questions or comments, please email us at info@advovet.co.uk. And please join us again for our next episode. Your pets will thank you.